And I'd now like to introduce our third speaker, who is Megan Palmer. Megan Palmer has a brand new job, I'm told, just as of today, the Executive Director of Initiatives in Bioleadership at Stanford University. And she's going to talk to us about COVID-19 and broader issues in biosecurity. Megan.
Wonderful. Thanks for having me today. For the last 4.5 years, I've been a senior research scholar at the Center for International Security and Cooperation at Stanford University. I lead an interdisciplinary group that studies how individuals and organizations contend with the responsible development of biotechnology, with a focus on how security is conceived of and managed. And as Rob mentioned, today is actually my first day in a new role at Stanford as Executive Director of Initiatives on Bioleadership, an effort spearheaded by bioengineering, but designed to connect with efforts across and beyond the university to both explore how biological science and engineering are shaping our societies and to guide innovation to serve public interests. This effort is driven by recognition of the increasingly important role that biotechnology plays in our societies, including safeguarding against biological threats. Less than a month ago, I was testifying in the US Senate about the need for strategies to prevent and prepare for future biological threats, as otherwise COVID-19 will not be the last and likely not the worst pandemic. Biosecurity is a very broad area, but today I wanted to touch on two topics where COVID-19 is shedding light on long-term strategic issues. The first is how we prioritize and manage biological threats in an evolving international security landscape. And related to this, how do we deal with technologies that can both mitigate and cause security threats? That is, they are dual use, including technologies at the intersection of biotechnology and AI. So first, the evolving security landscape. Experts have long warned about the seriousness of biological threats, and in spite of this, these threats often receive low and inconsistent attention relative to other security areas such as nuclear risks. The US and other nations have biodefense strategies, but we're seeing the ways in which these strategies can fail in both design and implementation, especially coordinating across nations. One issue I want to highlight today is the underlying challenge of estimating the scale of these threats. There are several different origins for biological threats. First, there are naturally emerging infectious diseases for which we have the most experience and data. This pandemic is in many ways the least surprising set of events, and yet even experts calling to take these issues seriously often underestimated the consequences. Secondly, there's the possibility of accidents from labs that are studying pandemic pathogens. And third, there is intentional misuse, including the possibility of weapons development by state or non-state groups. For these last two categories, our threat estimates are highly uncertain, and experts disagree both on the scale of the risk and the likely effectiveness of risk mitigation strategies. The events of this year will undoubtedly change risk perceptions and how we prioritize these different types of threats as a result. And there is a question on how that risk calculus should change. These events will also change how we think about consequences, including knock-on effects and intersections with other security domains, like information security, that create compounding vulnerabilities, as my fellow panelists are highlighting today. Some of the work my group has done involves looking at different estimates and conceptions of risk and how they do and might inform our threat prioritization, especially in the midst of great uncertainty. We also have developed scenarios of different security threats to study how we might avoid over-indexing on any particular type of threat, blinding us to future possibilities. There can be future pandemics, natural, accidental, or intentional in origin, that may dwarf or look very different than the current outbreak. Which brings me to my second related topic. How do we manage technologies that can be used for good or for ill, that is, they are dual use? For good, we are now relying upon innovations in biological science and engineering to deliver the diagnostics, therapies, and vaccines we need to respond to pandemics. As we'll hear later today, AI and information sciences more broadly are a critical part of that tool set. For bad, we see the devastating impacts that infectious disease can have on our society. How do we safeguard against accidentally releasing or intentionally creating organisms that could cause just as, or potentially even more devastating consequences? And this dual use nature applies not only to biotech. How do we ensure that the surveillance tools we develop to help prevent the spread of disease don't create longer term vulnerabilities that suppress civil liberties after this pandemic is over? I think it might be helpful to share one example of a conundrum in dual use management that has been a focus for my group. Advances in biotechnology are enabling research groups around the world to synthesize novel viruses in the lab without relying on the physical delivery of samples from patients. For example, in February, Swiss scientists created a synthetic genomics platform for reconstruction of the SARS-CoV-2 virus and published their methods in an open preprint server bioarchive. Broad access to these methods can enable the rapid development of diagnostics, therapies, and vaccines that we need to respond to emergent threats. However, as methods and tools spread across the world, we also must wonder at what stage they can generate new types of risks and how those should be managed. This is not a purely hypothetical concern. In past outbreaks, such as the SARS response in the early 2000s, we saw cases also of laboratory-acquired infections. And moreover, we know that the same types of processes that can enable reconstruction of viruses for groups working to end this crisis could very well be used by others attempting to manufacture this or other viruses for ill purposes. So one of the things my group looks at is how we decide when and how research contributes to security rather than undermines it, as a function of both the conditions in our research settings and changes in the global threat landscape. It's worth noting that in the US, labs doing certain research on novel coronaviruses experienced a temporary federal funding freeze in 2014 as a result of oversight bodies being concerned about the risk this might generate. And the resulting policies that were enacted around the care and oversight of potential pandemic pathogens designed to manage research-related risks are actually undergoing assessment and revisions. And this assessment will certainly be influenced by the latest events.
1 minute.
I won't have time to go into it today, but our group combines different methods and fields, including risk analysis, social psychology, and policy assessment to examine the underlying assumptions in these policy and oversight designs, and also examine the organizational and governance strategies that might be used to adapt those policies in response to new information. So just to conclude, COVID-19 will certainly change how we think about biological threats and how they should be managed, including how we manage the innovations in science and technology that can both mitigate and cause wide societal harms. The stakes are high, and we need more work to understand how we respond and manage risks in the midst of great uncertainty in ways that are closely coupled to those on the ground, making real-time decisions and informed by a variety of different disciplines. Thanks very much for having me join you today.